It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Well, folks, we're at the Hazleton Health and Wellness Center here, right off the Hazleton Airport Beltway, right across from Walmart. And today, folks, we're going to give you a good understanding of all of the therapy services that they have to offer here. And I've been saying this for years, okay? When you talk about healthcare in this area, second to none. You know, the bar has been raised and it continues to be raised every week with the Hazleton Health Alliance. But today, I thought it'd be a good opportunity for you to understand all of the therapy services that they have to offer here. So to start off, we're going to talk to Catherine Gallagher, who is a rehab supervisor. Catherine, thanks for having us here today.
Thank you for coming. We appreciate it.
Always a pleasure to be here. All the activity, it's exciting. People are happy. They're smiling. You know, they're in a good mood. It's great.
It's a great place.
Let's give an introduction for those people who are not familiar with the Outpatient Rehabilitation Center here. Give us an introduction to this.
Well, my name is Catherine Gallagher. I am also an occupational therapist. I have about 10 years experience. I am also the supervisor of outpatient rehab. Part of outpatient rehab, we have physical therapy, occupational therapy, speech therapy, fitness, and nutrition, and we offer that for adults and pediatrics.
Okay, now so when you're talking about the overview services, okay, you have different things that you offer, like you have the electronic medical records, you know, and the website and the resources. Give us a little understanding of those.
Well, the electronic
and why they're important.
The electronic medical record is actually very important. That's our documentation system. And what that is that stores all of the patient's medical records in one spot. So if they go to the hospital or to their physician, if he's part of our Health Alliance, those records can be accessed from one computer system. You can go to see your doctor, he can pull your records up from rehab, know how you're doing in rehab. If for some reason you ended up at the hospital or in the emergency room, they have your records all in one spot. So nobody's guessing what's going on with you or if there's any problems that they're not sure of.
You know, I think that's a tremendous asset because, like you said, every doctor, when you're in a doctor's office, they have access immediately to what's going on here. It's also about the resources, the Medicare cap and your insurances. How does that work?
Well, if anyone has any questions about any different insurances, they can certainly call, you know, our central scheduling department. And as far as the Medicare cap goes, there is a Medicare cap that says that for physical therapy, occupational therapy, and speech therapy, there's only so much money allotted for those services under your insurance. But because we're part of underneath the Health Alliance, underneath the umbrella of the hospital, that cap does not apply to us. So we don't have to follow the rules of the Medicare cap.
You know, I've been saying this for so many times. When you look at this facility, Catherine, you're here every day, okay? It's a great facility, and the therapy services here really are second to none as far as...
They absolutely are. We have, you'll meet a bunch of our therapists today. They have different specialties that they'll talk a little bit about, balance and aquatics. You'll meet them individually. And also on our website, we have just launched a new website. It's www.hazletonhealthandwellness.org. And on that website, it's very user-friendly. You can schedule an appointment or you can go through and just read in depth a little bit about each service that we offer.
Well, Catherine, thank you very much. Catherine is a rehab supervisor here, folks. And like she said, we're going to give you an education today as to all of the services they have here, especially we're going to concentrate on therapy services. Now we're going to talk to Chris Danishevsky. All right, so we're going to continue to tell you about the therapy services that they offer here at the Hazleton Health and Wellness Center. And Chris Danishevsky, folks, he is the industrial rehab coordinator and rehab lead. So Chris, let me ask you, what is industrial rehabilitation and what are some of the services it includes?
Industrial rehab is actually the treatment and prevention of work-related injuries. We provide a variety of different services here at the Wellness Center. We have companies that like us to do pre-employment capability test, which involves a lot of our equipment here. We test potential employees against their job descriptions. And what we do is we see if they can lift the required amount that they need to lift at the levels they need to lift at. We see if they can push and pull, if they need to push and pull things at the job. We see their repetitive movement capabilities to see if they can bend, if they can squat, if they can ladder climb, stair climb. Whatever that job entails, we make sure before they take that job that they're a good fit. Typically that comes after the doctor does the physical, clears them from the physical, and sends them over here.
So in doing that, you have to have a relationship, I guess, with the industries, okay?
Exactly.
And how does this relationship work?
We have strong ties with a lot of local industries. We have job descriptions. We developed a lot of job descriptions for some local industries. And when we do these pre-employment capability tests, they're all based off the job description. So the employer and the potential employee knows if it's a good match for them to take this job.
So you work hand in hand with these people, okay?
Definitely, absolutely.
So the employer knows that when the person comes back, they are fully capable of doing the job.
Yes, and the potential employee too knows if they're a good fit for that job.
And do you monitor that?
We do. We take blood pressure, we take heart rates throughout the test to make sure they're responding well and physically able to do the job.
There's another therapy here that I find very interesting, and I'm glad you have it. It's a new service. It's the low vision therapy. What is that?
That's a new service that we're developing. We have a therapist that's certified in low vision. We're going to be rolling that out very soon. Low vision is typically vision that cannot be corrected fully with lenses. A person has some usable vision, but we can expand upon that and improve upon it through therapeutic techniques. So that will be rolling out very soon.
And now we're going to talk to Dr. Courtney Pierce, folks, and she's the head of the Osteoporosis program. Now, before we talk about osteoporosis, what it is, tell me about yourself, Doctor.
My name is Courtney Pierce. I've been a physical therapist for the past 6.5 years, 3 of which I have done here at the Hazleton Wellness Center, and 3 that I've done in Wilkes-Barre.
Okay, now, for those of us who don't really fully understand what osteoporosis is, what is it?
Osteoporosis is basically a disease that happens to your bones. What happens is they become weak and brittle, and you're actually prone to more fractures.
Who does it mostly affect?
Mostly it affects women, especially over the menopause ages, but it can affect men as well. There's also other things that can be attributed to osteoporosis, such as your family history, if you have a thin bone structure, your diet, so if you're not taking in enough calcium or vitamin D, as well as, you know, other habits, smoking, alcohol intake, and stuff like that.
That affects this, okay.
Yes.
And how many people do you think suffer from this?
There's actually probably about 10 million people that actually suffer from the disease.
Wow. Now, okay, so how is it detected, and then how is it treated?
The only way to actually detect osteoporosis is with a bone mineral density test, which we actually do downstairs in the Wellness Center here. And what happens is they'll scan your body and they'll check your bone mineral density.
Does that hurt?
No, it doesn't hurt at all.
Because you know I'm a big baby.
No, it's not going to hurt at all. And then what will happen is they'll get your scores, they'll send it to your physician, and then once it comes back, if your physician thinks that you have osteoporosis or if it's a low T-score, then what they'll do is maybe put you on some medication.
Okay, so how would I know whether I should come for this test or not?
Usually it's anybody if any females over the age of 65, if you've ever broken a bone over the age of 50, and men over the age of 70 should definitely have a bone mineral density test.
And then you have to go to the physician and then...
Family doctor will give you a referral. Yep.
All right, so it's nothing to be really upset about. I
No.
It's a simple test, okay?
Simple test, and you have it every 1 to 2 years.
Okay, then, all right, so let's assume someone has it or whatever. What do you do?
Now, studies have found that actually any sort of weight-bearing activities, resistance training can actually help improve your bone mineral density that you have lost over the last couple of years. So what we'll do is we'll do an initial evaluation on you, check your strength, if you have any balance issues or anything like that. And we'll give you a customized program to fit your needs. So we'll teach you like any weight-bearing activities, walking, jogging, step-ups, resistance activities, weights, and then we'll send you over to occupational therapy, and what they will do is actually educate you a little bit on fall prevention, proper body mechanics, so you don't go into that risk of fracture.
This is great because this way you have a chance of understanding what the problem is, and you have solutions here to fix the problem.
Correct.
All right, well, thank you, Doctor. Appreciate
You're very
it.
welcome.
Now let's move on to sports medicine. Now in sports medicine, folks, we have Dr. Paul Marenich, and he is the main person here in sports medicine. So, Doctor, tell us about you and a little bit about your credentials before we talk about sports medicine.
Well, I started off, I got my PT assistant's degree out of Penn State, went back, got my doctorate from Arcadia University in 2008, and I've been doing outpatient orthopedics for the past 3 years.
Okay, now we hear a lot about sports medicine, okay, and some people have different connotations of what sports medicine is. What is sports medicine?
Sports medicine deals primarily with athletes, just like the name suggests, sports medicine. What it deals with is the diagnosis and interventions for the patient, as well as different treatments that we might do, as well as prognosis on how far they might have to go in order for that complete rehabilitation.
What is your role here?
What I do is I work with the doctors in the area, as well as a few other doctors outside of the area, with rehabilitation of people in general, the regular Joe off the street, as well as the athletes in this area, whether it be for an ACL reconstruction or something to that standard.
Being in sports medicine, you need to work very closely with the orthopedics. Yes. Okay, and how does that work?
What they'll do is they'll send the patient over. They'll call over with a script, and we will take that script and go through an evaluation of the patient. Once we figure out what exactly is going on with the patient, the physician usually gives us an MRI report, but sometimes they can be skewed if there's a lot of edema in the area. The swelling around the area usually prevents them from seeing a full scan of the MRI report. So we'll go in and we'll also check it to see if what they are suggesting is exactly that as well. And from there, we'll give our information back to that physician and come up with a treatment plan. They'll say, okay, follow these. Some doctors usually after like an ACL reconstruction, they have their own guidelines based on their many years of practice, as well as they'll let us do what we know that we can do. And from there, we would give them updates on the patient. If we find any problems in particular, we will notify the physician and also inform the patient. You might want to go and see your physician about a certain problem before we continue with any further therapy.
So that's good. So you have a great relationship, so the person has a full recovery and at least a healthy recovery, correct? Yes. All right. Folks, Dr. Paul Marinich, who is involved here with sports medicine. We're here at the Hazleton Health and Wellness Center. And as I said, folks, it is amazing the health care that we have in this area. I've been saying it for many, many years. Now let's talk about more about the therapy services here at the Hazleton Health and Wellness Center. All right, folks, now we're going to talk to Carlene Martonic. She is a certified lymphatic therapist, okay? And women, I think you're going to really want to listen to this particular segment. Okay, Carlene, as a certified lymphatic therapist, what is lymphedema?
Lymphedema is an accumulation of fluid in a limb. It can be in an arm, in a leg, in the head, in the face, in the chest. Wherever you have skin, you can get edema.
Okay. And then how is it treated?
We treat it with manual therapy. We use massage, compression, exercise, and skincare.
All right, now, this could happen to anyone?
Yes,
Okay.
Men, women, children, elderly, people who are thin, people who are overweight. It doesn't discriminate.
Okay, now, primarily women who have breast cancer, okay? This is sort of like a higher area. Talk about that.
Okay. Any type of cancer therapy can cause lymphedema. Unfortunately, breast cancer carries a higher rate because breast cancer normally will move into the lymph nodes. They remove the lymph nodes or they radiate them, and then it causes swelling to develop in an arm. It becomes very disfiguring for women, and we've learned ways to treat it and help them get a better quality of life.
What's the success rate?
I would say about 90–95%. Just like with breast cancer, the earlier we catch it, the better we can do.
For those people who do not have breast cancer, thank God, but how would a person know whether they have lymphedema?
Basically, if you have swelling. In an arm, it's fairly easy to see or feel. The arm will feel heavy. In a leg, you can usually see it if at the end of the day you have indentations in your socks. You have swelling and it's not going away with diuretics or conservative therapy, then you may have lymphedema.
Okay, people, when they have these problems, they always like comfort, they like to talk to people, so you have support groups here. Let's talk about that.
We have a support group. It's about 30–35 people. We meet maybe every other month, every 3 months. We have a newsletter that goes out. Support groups are great. We have a lot of fun. We bring in speakers and we get together and we provide education along with support.
Well, I know when we were on the show before, we had a person on who had lymphedema, and she's doing fine, right?
She's doing very well.
Well, that's good. Well, folks, as we continue to go here, we're talking about the different therapies at the Greater Hazleton, the Hazleton Health and Wellness Center. Once again, folks, the information's on the screen. You could call the number and find out about anything that's happening here, okay? Now we're going to talk to Conjeta Zola, and we're talking about balance therapy. All right, folks, now we're going to talk about balance therapy, okay? GHHA Zola is the person here who is the main person about balance therapy. First of all, I'm very excited about this particular segment because I don't know what balance therapy is, but we'll find that out. GHHA, tell us a little bit about yourself.
Okay, my name is GHHA Zola. I've been a physical therapist for over 35 years. I've worked in the Hazleton area the whole time. And several years ago, we started a balance program. And since that time, we've been working on patients' balance with the local physicians. We get referrals from the physicians, patients who have difficulty going upstairs, standing on one leg, dressing and bathing, getting up from a chair. We help them to recover their balance to prevent falls. The main purpose of a balance program is to prevent falls. 1 out of 4 Americans in the United States will experience a fall. And falls are the 6th leading cause of death of people over the age of 65. So the main reason for our balance program is to prevent people from falling and becoming injured.
And that's why I think this is very important, because most falls, like you said, break hips, break legs, unfortunate things happen. If they would address the problem before,
right,
okay.
That's exactly
okay, so
it.
now how do I know that? How do I know that I should, go to my physician and say, look, my balance is a little bit off, okay, what would be the process here?
That's the first step. If you notice that yourself or a loved one is having difficulty getting up out of a chair, having difficulty going upstairs, getting in and out of the car, you should mention this to the physician. There's numerous reasons why people can have balance disorders. The first stop is the physician's office. He needs to review patients' medications. It's been found that people who are on more than 4 medications have increased loss of balance and at risk for falls. So we need to look at medications. We need to look at pathological diseases that may contribute to patients' falls. And then they're referred to physical therapy. Once they're referred to physical therapy and to our balance program, we'll do a thorough assessment. I believe we're the only place in the Hazleton area that has this computerized system. It's a Neurocom Balance Master, and it helps us to assess the patient to find exactly where their deficits are, but it also helps us to put programs together for the patient in which they can use the balance machine as visual feedback, okay, to regain their balance. And it's a matter of using other systems in their body that may not be working to promote balance to regain balance.
Has this been successful?
It has been. We've helped many patients, and we've had many patients come back and thank us for their ability and reduce.
I say this because you are out there, folks, who have that balance program problem. Please, if you have a balance problem, go to your physician. They have a great program here. Many of you fall down, break your hips. A lot of things happen, okay, particularly the elderly. It's a simple test. It's going to help you. Thanks, GHHA.
Thank you.
It's always a pleasure. Now we're continuing on here with therapy services here at the Hazleton Health and Wellness Center right off the airport Beltway. Phone numbers on the screen, folks. You call for any information. Now let's continue on with our interviews. All right, as we continue on talking about the physical therapies here, folks, we're going to now talk about aquatic therapy. I love it here. It smells fabulous, okay? And Gene Myers is the person here. Gene, tell us a little bit about yourself.
I've been doing this 15 years, strictly aquatic therapy. Aquatic therapy is basically doing land-based exercises in water. The water provides buoyancy, which decreases the patient's weight, and it makes it easier to move. The water is 94 degrees. It makes it easier for the people to move around. It makes the muscles limber. It just creates an environment where it's just easier and less pain. People have less pain to move.
So that's aquatic therapy?
That's aquatic therapy, yep.
And how does one know that they should have aquatic therapy?
Aquatic therapy, patients that have trouble or pain moving on land would be a definite pool candidate. I see a lot of patients with total hips, total knee replacements, deconditioning, low backs. People with low back pain really get relief from the aquatic program. It's a very versatile program. It could address a lot of issues in the pool.
Now the pool itself, I mean, people sometimes are a little nervous about water and the depth, and so everything's controlled here.
Yeah, the pool, it's a smaller pool. And it's good because it's a smaller environment. People don't get lost in the shuffle. They work exclusively with me. The water's only 4 foot deep. So it doesn't really come into play a big pool, deep water. So people that are afraid of the water actually are comfortable getting in. It'd be equivalent to getting into like a jacuzzi or a spa at home. There's nice steps going down the pool that people can enter and exit easy. We do have a lift to help people get in and out of the pool if there would be an issue that they can't perform, steps.
How does one get into this program?
They would see their doctor, and the doctor would have to refer them to aquatic therapy as traditional therapy. The patient can always suggest to the doctor that they'd like to try the pool therapy, that maybe go that route. Because a lot of times I see people that weren't successful on land, and the pool actually gives them the relief that they need.
You hear a lot about that because aquatic therapy, you can do much more in the water than you can do, like you say, on land. And who are some of the patients that would be using the aquatic therapy?
Again, patients with total knee replacements, total hip replacements, back injuries, fibromyalgia, a lot of different therapy conditions that would be seen in land-based translate right into the pool.
Now you work one-on-one with them?
I work one-on-one with them, yep.
And very private?
Yep, it's private. It's a small area here. Like I said, the locker rooms are right outside there, so they're in the pool, out of the pool, right into the locker room, so they're not in a big building or getting lost.
So if someone's out there having some pain and they feel aquatic therapy could help them, you'd be able to walk them through this, okay?
Yep, absolutely.
It's always the initial thing that people are a little nervous about, maybe a weight problem, etc. And don't even worry about that, folks. All kind of people, whether you are overweight or whatever, they're here to help you, okay? You work through
Right, exactly, yeah.
Okay, so let's do a recap now, folks, of what we saw on the show today on the therapy services. So as I said, Catherine Gallagher, who is the rehab supervisor. So let's give us a recap of what we saw today.
Well, basically, when we went through physical therapy, and we talked a little bit about our balance, osteoporosis, sports medicine, aquatic therapy. We saw occupational therapy, where we treat hands, we treat work conditioning injuries, work-related injuries, and do a lot of work with our companies. We have speech therapy. And in addition to all of this, we also offer our patients 2 free weeks in our fitness center. Our fitness center has exercise physiologists that are on staff at all times that we're open, that can help them with, kind of teaching them how to use the machines and the right way to do things. I know a lot of times when people get done, they're a little bit afraid of the gym setting, and our gym is more of a more relaxed setting where we have, physiologists, exercise physiologists out there helping them with the machines at all times, so that they're doing the exercises properly.
And that's the thing that I think is so important, because people want to get into a physical program, and I should be one doing that, okay? I should be coming here seriously 3 days a week, doing some therapy. And
I'll get you a free pass before you leave, Sammy.
Yeah, give it to me, because it's very important, folks, okay? And it's really healthy for you if you have any high blood pressure or pre-hypertension or whatever. But the thing that I like, Catherine, here is that everything's monitored. You have doctors around. God forbid something should happen. You feel secure. I mean, that's important.
We really have like one-stop shopping.
Yes.
I mean, everything is in this building, from X-ray to MRI to CAT scan to cardiologists, orthopedic surgeons, occupational health, fitness. I mean, we have everything. You could stop in this place and get everything done at the same spot.
I think it's fantastic. We're talking about healthcare, folks, and Catherine, I've been saying this for a number of years. We have the finest doctors in this area. We have the finest healthcare. We have people who call me and say, Sammy, one time we had to go out of town. Now people from out of town are coming here, which is fantastic. The bar has been raised here. Your people here are fantastic. They're all pleasant, and really
a ton of experience.
Yeah, I was going to say the experience is unbelievable. And there's no reason for anyone to not feel healthier coming to the Hazleton Wellness Center here. Well, I thank you for
thank you for coming. I mean, you're welcome back anytime. Thank you very much.
I get that free pass, right?
You do right now.
All right, folks. Remember, there's the Hazleton Health and Wellness Center. Phone number's on the screen. Call for information. If you're having trouble with your balance, osteoporosis, whatever the case may be, get to your physician. We're here to help. Okay? They've raised the bar up, folks. We're very proud of the health care we have in this area, especially for all those people who work in the hospitals and the different clinics, the nurses, the aides. They're just fantastic. We'll see you next time.